My name is Steve Thompson, co-founders of Revolution Sports Performance, and at Revolution my title is the Chief Sports Rehab Officer. I'm the one who actually developed the ACL screening tool and the ACL rehabilitation program. I'm a physical therapist by training, and for me the most important thing is seeing athletes have a long, safe, healthy life.
Revolution started because we wanted to help prevent youth sports injuries, and also because we wanted to work on doing more prevention in the population as opposed to just taking care of problems. We see people with ACL injuries which come from a few different things. One is from a contact injury, and that's something that you really can't prevent other than making an athlete quicker and faster. But really what we wanted to prevent was a non-contact injury. And non-contact injuries come from either a hyperextension or from an improper landing. We're not going to change a lot of anatomy differences, but what you can do is you can strengthen an athlete's core, and you can make some certain fundamental changes in how an athlete jumps and lands. And that's where we're going to get a lot of prevention.
The anterior cruciate ligament is one of the most often injured ligaments in the knee. At the current rate, there's about 200,000 ACL injuries per year. At Revolution Sports Performance, we're dedicated to try to minimize or eliminate these types of injuries in all sports. What we do is we look at the assessment of the knee and how they relate to possible weaknesses. Once we've completed the injury screening, the most important thing is to actually enroll in our ACL injury prevention program, where the athlete will be taken through high-level sport-specific activities such as cutting, jumping, landing, strengthening of the knee, the hip, the ankle, the core, all those muscles that will best help support the knee when they're playing their athletics. Some of the biggest keys to prevention is awareness, screening, prevention, and training. The awareness is first teaching the athlete how to properly land and where their knee needs to be in space. The screening is basically just determining the risk. Is there one knee that's maybe more at risk than the other? The prevention is actually doing the work before you even start the program. And then training is the off-season, which is where you can make the most gains and make the most injury prevention.
Hi, I'm Dr. Mark Lawler, orthopedic surgeon. What we'd like people to know out there is ACL injuries are fastly becoming one of the most common knee injuries amongst sport athletes. Costs associated with ACL injuries. Surgery in and of itself can cost up to $15,000 to $45,000. Lots of time of competition. Upwards of 1 year of rehabilitation, difficulties and loss of school time, as well as maybe not returning back to your previous level of competition. What we're trying to do is implement screening programs so we can identify who is at the highest risk, and also implement programs that are preventive for this to try to decrease the risk of these injuries.